If your knee pops or cracks or grinds, what could it be? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. Knee popping, knee cracking, knee grinding is a really common complaint. I've actually got it in my knee, and I've had it since I was a kid. I can remember it when I was younger, and a lot of young athletes have it. So what is it? Well, there's a lot of reasons you can have what we call crepitus, a grinding sensation as your knee goes through a range of motion. And a lot of times there's not even any structural damage causing it. We always think, adults especially when they come to the office, oh, it's got to be a sign of arthritis. But with kids, that's not typically true. It could be how their kneecap tracks and issues with muscle weakness, things like that aren't really a big deal. Now, with adults, it can be things like, yes, arthritis or a breakdown of the cartilage underneath your kneecap that's causing a grinding sensation. It can be other things like, a meniscus tear or something like that. Typically, though, here's the thing. We don't get too worked up about cracking and grinding under the kneecap. A lot of times, again, you go to scope the knee, you may not find anything, number one, or two, it's wear and tear of the cartilage that you can't do that much about. What we're trying to get you better from is overcome your pain. So in our younger patients, a lot of times it's going to be things like physical therapy to strengthen the muscles around the hip and the knee, take pressure off the kneecap. A lot of times the discomfort goes away. In adults, it can be a little trickier. It may be things like physical therapy, maybe anti-inflammatory medications, occasionally injections, and yes, sometimes surgery, depending on what the problem is. All right, do you have cracking, popping, grinding in your knee? What is it? What did your doctor tell you it was, and how did you get over it? I'd love to hear your experience. In the comments below, share your experience. I can't answer specific medical questions that you leave there for legal reasons, but I'd love to read it, and I bet people watching from all around the world would love to hear your experience as well, because they're probably going through the same thing. Now, I would also like to give you the number one next thing that you need to do or that you need to know to overcome your knee injury. In the description below this video, the very top link will take you to a page on my website where basically you answer a few questions. It takes like 20-30 seconds. That'll give me the information I need to give you the number one thing to do, the number one thing to know to get better after your knee injury. I think it can be really helpful. That's in the description box, the very top link. If you like videos like this and you want more information on sports and exercise injuries and injury treatments and injury prevention, subscribe to my YouTube channel. I record several of these videos every single week. I even do an Ask Dr. Geier live video every month or so, and you'll get notified about all of those directly if you subscribe to my YouTube channel. So click the subscribe button on the upper right corner of the page. Thank you so much for watching. Really hope this was helpful for you, and I look forward to seeing you right here next time.